What can go wrong with your pelvic floor? Let's look at some of the issues that you can have. Firstly, you can have stress incontinence. Stress incontinence is one of the more common forms of pelvic floor dysfunction that someone can have, and it's usually around when I coughed or I sneezed so hard that I wet myself. So it's around the leakage. Some people might call it light bladder leakage, but mainly it's just any kind of leakage that happens when you add some kind of stress onto your pelvic floor. Could be dancing, could be exercise, could be just having a jolly good old laugh with your friends. The other type of incontinence that you can have is urge incontinence. This is just a little bit different to stress. This is when you actually have the urge to pee. And it usually happens to women when they just stop their car and they go to get their key and put it in the door, and you get that little kind of jiggle and you go, oh my gosh, you can do a dance. And then you've got to get to the toilet really quickly, and you're trying to get your zip undone, trying to get your pants undone and get to the toilet without wetting your pants or peeing all over the floor, or even indeed getting to the toilet in time. That's urge incontinence. Sometimes women might have a mixture of those. There's also another thing to think about, is that what can also give that idea that you might have weakened pelvic floor muscles is that you actually might have the flip side, having tight pelvic floor muscles, and that's when your pelvic floor muscle just won't relax and it can't lengthen, and so therefore it makes it feel like your muscle is ineffective, and so you leak or you have pain when you have when you have sex. So sometimes it's good to just get that checked out to see whether it's due to a tight pelvic floor or whether it's due to a weakened pelvic floor before you start going ahead and doing pelvic floor exercises to help this issue that you have. The next lot of issues that you might come across is anal incontinence. Anal incontinence is when you can't hold wind in, when you can't get to the toilet in time, when you might have a look on your underwear after you may have done a poo in the morning, and then later on you go to do a wee and you wipe yourself, and all of a sudden there's this soiled feces on the tissue or on your underwear. It might be that the other side of things is that you might actually suffer from constipation, or that you've got a strain a lot to go to the toilet. That might not have anything to do with pelvic floor issues, but it certainly could develop and make your pelvic floor muscles weaker, and that's something that you need to discuss with your doctor or with a pelvic floor physiotherapist with as well, to see what's going on with your bowels. The other one is prolapses, and prolapses, some women don't even know they've got a prolapses. They might have, there's different grades, there's first and second and third grade prolapses that you can have. Third grade is when it's coming right out of your vagina, and the prolapse is that you've either got a bladder prolapse or a uterus prolapse, your womb, or your rectal prolapses. Some women actually can have two or more. And it's when the tissues and the fascia sitting around each of the organs gives way. And then when it gives way, then say if it's the bladder, it will give way and the bladder will kind of come down a little bit. And so it just weakens the pelvic floor, it puts more stress on the already weakened pelvic floor. And what it feels like is, it feels like a bulging sensation or a heavy dragging sensation. Some women I talk to say it's almost like the feeling of, you know, the children's balloons that you fill up with water? It's like that kind of feeling. It's a dragging sensation. Some women can actually feel it outside their vagina, and it rubs on their underwear, and it's actually quite painful and irritable, and maybe bleed a little bit. Or sometimes it's just sitting up inside, and it might feel like it gets worse around the time of your period. And then some are just sitting just up at the top. That's a grade 1. It might sit there forever, or it just might unfortunately have some kind of more pressure put on it, like a pregnancy or high impact exercise, whatever, and it might come down a little bit more. The other type of dysfunction that you might have is sexual dysfunction. And this is a type of dysfunction that can be quite emotionally affect you. It's where you don't feel any more desirable, that the joy of sex actually gets taken away from you. It might be that you wet yourself a lot when you are having sexual intercourse. It might be that the intercourse that you're having is painful. it's something that you would like to get checked out as well. You know, a lot of women have got sexual dysfunction, and not many of them will go to the doctor or see their healthcare professional because they're too embarrassed to, or they think there's nothing we can do about it, or they just think that there's nothing that can be done for them, so they don't seek out help, which is really unfortunate. I would say to help you with all these problems is to definitely do your pelvic floor exercises, and if you're not getting any joy from that, then seek out professional help. And to perhaps look at doing pelvic floor safe exercises. So they're exercises that you do to keep fit, that aren't going to put any more pressure onto that pelvic floor and make your situation even worse.